Yeah, good morning, people, as always. So, I thought of talking about this topic today because the other time I was talking, it was on live streaming, and my children were there, so they were disturbing. But I think it is important that I should say it in a quiet time when they are not home. It's about pregnancy and healthy as women that we are. So last time I shared a little bit highlights about my teeth, the experience of my teeth and my two last pregnancies because the first pregnancy I don't remember if I had any issues, but the second one I remember that I used to bleed sometimes when I'm brushing my teeth when I was pregnant. And I want to believe that maybe I had some swellings in my swelling some in my gums, but I didn't pay attention to it. So when I became pregnant now the third time with Momon, the swelling was so much I could even notice it, but there was no much pain, but just discomfort, especially if you want to chew something and the brushing. So I contacted my doctor that time. So she told me that it's normal among women, during pregnancy and stuff like that, because I didn't have much experience about it. So I let it be like that. So when I delivered, then it went back and I was okay. The gums went back and it was okay. But when I became pregnant again for Marvelous, the same experience again came back. The swellings, I started swelling up again. So there was too much discomfort by then and so much bleeding. Sometimes even when I'm not brushing my teeth, I could notice that my gums are bleeding. So I tried to ask if I could get some help, medication, and stuff like that. So the doctor said me, since you are pregnant, it is very difficult to get a lot of medication and help. But because you are pregnant, it is normal to be like this. So I stayed with it. But after I delivered Marvelous, the swellings did not go down like completely. Especially my front teeth like this, these ones, these four. It didn't go down completely. Yeah, I'm still swelling even up to now. So last time I went to the appointment for the uh, dental clinic. So they told me that I developed some. I don't know if it is infection or it is a problem. I don't remember how they mentioned the thing. So they say that my gums have problem because of swelling and coming down. So when they swell up, when they come down, they go much down than the way it was normal. So they told me that if I don't get help the way it is now, as time goes by, my teeth will start shaking, like losing, just shake without, because I don't have pain. So they will just start losing, and when the teeth are shaking and stuff like that, it's very, very, you can't feel comfortable. Even chew, you can't chew well when the teeth are like like this. They have to be strong and like that for you to use them very well. So they started giving me some guidance and things that I should be using to try to treat this gum, so that they will not let my teeth loose, because if they loose now, I just have to remove it out. I don't have like to have it and stuff like that. So I thought of talking about it because sometimes when we are pregnant as women, we overlook these things. Swelling, it is part of my experience. Each time I'm pregnant, I swell up. Like for example, my first pregnancy, I used to swell up my hands, this wrist like this, and also my foot, my legs there. I used to swell up so much, but whenever I just deliver, the swelling will just go away. So I want to believe that sometimes those muscles, when they swell up and stuff like that, I think that's why sometimes when women, as we make children, as we grow, we start having a lot of complications, like I feel pain in my hands, I feel pain in my legs. So I thought of talking about it, especially when it is that time of massaging. But this topic of massaging and stuff like that, muscles, I will talk about it. I'll make another video to talk about this one, like massaging the whole body and stuff like that after delivering, and also during pregnancy. I'll talk about it so that someone can learn. But for today, it is just for teeth. So please, if you have experience of bleeding, of like swelling up and stuff like that, after your baby has you have given birth, don't just overlook these things. Go and visit the dentist and explain the experience that you had during pregnancy. Then they will know how to help you so that you not lose teeth at a young age. You not lose teeth because of this. Because if you don't work on it, it will affect you as time goes by. So please, please try and visit the health personnel. They will guide you, explain your situation. They will guide. Don't just sit home and forget about it. It will affect you in as time goes by. Like this, my teeth was not like this. So I want to believe that this gap after I had David. So because I didn't pay attention to it, so you see now I have gap. It's because I was swallowing a little bit, but I didn't pay attention, and this thing started gradually. I was not like this. My teeth were closed, all of them. So this came after I had David. I remember that after I had David, I started having some small space as time goes by. So now when they told me, that's when I recall back, and this is how this thing started. So please go and visit the dentist. Don't let yourself be destroyed. Go and visit, they'll help you. Me, I got help. So I thought of sharing. This page is for learning, for sharing ideas, for sharing experiences as mothers that we are. So please, if you feel something like that, go and visit the clinic, the doctors, whatsoever it is, they will help you and they'll guide you on what to do. Thank you very much for your support and for everything. I always appreciate you so much.